If you've watched other videos on this YouTube channel, especially the ones that relate to dysautonomia and long COVID, you will notice that there's a lot of information on the autonomic nervous system, on long COVID, and there is a huge focus on exercise as a means of managing the symptoms. I have put together this playlist to address a lot of the aspects of long COVID and chronic fatigue syndrome because I see patients in my clinic with a lot of these symptoms. As time has gone on, the clinic has become really busy and now I have an 11-month waiting list. So I thought it would be a good idea to put a lot of the information that I chat with patients about during the clinic onto the channel so that if you are referred to my clinic, you can have a chance to have a look at a lot of the information that I discuss. It can be useful maybe to think about exercise and your symptoms ahead of the clinic appointment. And because the clinic appointment could be 11 months or longer away, it's nice to have something to do in the meantime. So a lot of the information is on long COVID, but I just wanted to say that long COVID overlaps significantly with the symptoms of chronic fatigue syndrome, and there are many healthcare professionals that actually consider them to be almost the same condition. There is some research to suggest that chronic fatigue syndrome is a form of a dysautonomia where there is an imbalance of the autonomic nervous system. So you have an excessive sympathetic activity and you don't have enough parasympathetic activity. So you end up using a lot of energy far less efficiently, and I've explained this in the video on the autonomic nervous system. So because there's a huge overlap in the conditions, a lot of the advice I give really applies to both conditions. So sometimes I'll say long COVID, sometimes I'll say chronic fatigue, but really depending on the type of symptoms you have, a lot of the information pertains to both. Obviously, there are some patients with long COVID who fall more into the POTS phenotype or the POTS category of symptoms, and they may be treated in a slightly different way to chronic fatigue syndrome. But again, even in a lot of patients who have POTS or orthostatic intolerance, fatigue and poor unrefreshing sleep and brain fog are hugely common symptoms. So you can see there's a huge overlap. So I just wanted to explain that even though I'll use the two terms, really all of the advice and the information on this playlist and a lot of the exercises on this channel are really designed for all of these symptoms.